Thank you. So in this coming 15 minutes, I'm going to give you a summary of the data published from the Asia-Pacific region on stopping TKI therapy. Now, basically, from the literature, I can actually identify 4 studies which has been published about evaluating, stopping TKI treatment-free remissions. I'm going to go through that in details. The first one is actually a Japan survey study. This has already been published in 2012. Now, this is by itself is not really a clinical trial, but it's actually a countrywide survey done in Japan. They sent out the questionnaires to all the hematologists and asked if they have stopped the treatment for any patients. And they received the return, okay? And out of that, and then they sent another questionnaire asking for details about those patients. And in this report, they mentioned that they have found in the whole Japan about 50 patients who have actually attempted stopping treatment. And they've been able to get the information or the clinical data about 33 patients who had discontinued imatinib for at least 6 months. Okay. And out of these 43 patients, they find that the loss of this complete molecular response was detected in 19 patients. Now, in fact, all these patients stopped the treatment after they achieved undetectable PCR level. And out of that, about 19 of the 43 patients lost the complete molecular response. So they estimated that the complete molecular response rate was about 47% following imatinib discontinuations. And they also go into a little bit more detail about these patients, the characteristics, and they find that if the patients can actually achieve complete molecular response for more than 24 months, for more than 2 years, they have a better chance of having a good treatment-free remission. While if the sort of complete molecular response is less than 2 years, they have a higher chance of having the disease coming back. The other things that they have identified is that the dose, how much dose of imatinib that the patient has used, and also the use of interferon before, all can predict sort of a lower risk of molecular response relapse within 12 months. Now, in another study, this is the STEAM study. This is a discontinuation of imatinib in patients with CML and sustained complete molecular response for over 2 years in the Japanese population. So in this study, they've actually recruited patients who have actually received imatinib, already achieved complete molecular response. That means when they do PCR, they no longer detect the BCR-ABL for more than 2 years. And then they try to stop the patient's treatment and see the response. So in this paper, which has been presented 3 years back, they have recruited 40 patients. And the median time on imatinib treatment was about 98 months. And that ranged from 2 years all the way to 10 years. So some patients already received the treatment for more than 10 years. And in terms of how long this patient has already achieved undetectable molecular response, is about 45.5 months. And again, that ranged from 2 years to close to about 9 years. So, and then after a median follow-up of 1.5 years, and then they find that 18 patients, that is about 36.7%, or 1/3 of the patient, require retreatment. That means they actually lost the undetectable molecular response. And basically, nearly all the patients, all except 1 patient, after they've been given the TKI again, they achieve a complete molecular response again. So they estimated that the drug-free rate of this group of patients at 1 year is about 55.4%. So this is a figure summarizing the data. You can see that if you're talking about the drug-free probability, and you can see that about 1 year is about 54.5%. And again, you can see that if the patient can actually achieve a much longer complete molecular response, which in this case is 73 months or more, they have a much better chance of staying free of treatment. While those patients who got a shorter duration of complete molecular response has got a higher chance of losing the molecular remission. So they also look at the side effect profile. They find that, okay, of course, patients on imatinib, they report some side effects. So if they withdraw the treatment, then of course the side effect improve. But even with that improvement in sort of side effect, the quality of life of this patient did not show any changes. Okay? So in conclusion of this study, it's reported that sustained complete molecular response was achieved in a substantial proportion of patients who had been in complete molecular response for more than 2 years. And it seems that all patients restarted on the same TKI remained sensitive to treatment. And the longer time in CML was identified as a significant factor related to sustained CML in the patient population. There was also another study, okay, being reported last year and in Korea. This is the Korean imatinib discontinuation study, or short-term KIDS. They've got the update data with 15 months of median follow-up. So in this study, again, they recruited patients who have already been treated with imatinib for more than 3 years, and then with undetectable sort of BCR-ABL in qPCR for at least 2 years. So when they collect the data, by July 2014, they've already recruited 115 patients. And the median duration of imatinib therapy was about 7 years, and ranged from close to 3 years to actually more than 10 years. And the median duration of the sustained undetectable molecular disease is about 44 months. Again, that range from 1 year to actually more than 10 years. So you can see that with a follow-up of 15 months, 28 patients actually lost the MMR. And the probability of sustained MMR, major molecular response. Now, this one is not undetectable. They still detect it, but it's less than 0.1. At 12 months, was about 2/3. So 2/3 of the patients, after stopping the treatment for 1 year, can still has a sustained major molecular response. And again, they find that both the duration of the previous deep molecular response and also the duration of imatinib treatment can predict for successful therapy stop. And again, in all those patients, 28 patients who actually have got the loss of MMR, they were retreated with imatinib. And about close to 80% re-achieved MMR, and about half of them actually re-achieved undetected molecular response, or kind of a complete molecular response. And in that 15 patients, actually one patient has got a second discontinuation, and then achieved, and then with a follow-up of 6.5 months, still remain treatment-free. There are another 21 patients who actually has got a low level of BCR-ABL being detected on the PCR test, but they still below 0.1, still maintain major molecular response. So they didn't treat this patient; they just observed them, and they find that actually about half of them, the low level of BCR dropped again and become undetectable. Okay, so this low level of disease may not actually require treatment. They may disappear, okay, or they may become stable. So Dr. Ross has already mentioned this study trial. This is the one being done in Japan, and the difference of this trial compared with the previous imatinib trial is that they require only a kind of a molecular response, which is MR 4.5 for at least 1 year, and then you recruited that. Because the study team estimated that if you put the patient on the second generation TKI, if the patient achieves a complete molecular response for 1 year, it may be as good as having a complete molecular response with imatinib for 2 years. So as highlighted by Dr. Ross, and the estimated molecular relapse-free survival at 6 months was about 48%. And the reintroduction of the dasatinib to the relapsed patient showed rapid molecular responses in all of them. So this is a busy slide, but I just want to highlight that I've put basically the summary of all the studies that try to stop treatment worldwide and also in Asia together. And again, you can see that roughly, okay, if you talk about imatinib, these are all the studies related to the treatment-free remission for imatinib. Roughly, where we are around 40 to 60% of the patients can achieve a treatment-free remission. If you talk about the second generation TKI, in Asia, we only have the DADI trial, and it's about 50% kind of estimated treatment-free remission at 6 months. So again, The other study that has been published shows a rate of around 60%. So it's still more or less somewhere between 40-something to 60% of the patients can achieve treatment-free remission by, say, for example, 6 months, 1 year, or even longer. So this is the end of my presentation about a summary of all the data available in Asia-Pacific region. Thank you.
Thank you, Dr. Raymond Wong.